and how a mentor feels on the other hand. So they have the questions and the answers. And then to address all the constructive criticism that we've had, we have an elite panel of all the mentors and the who's who of the ASSI, the people who've made the ASSI and are still making it. And hence this overall turns out to be a very, very interesting finale to our three-part session of the fellowship training program. Now, over a decade ago, the ASSI envisaged a fellowship that could have a stamp of the ASSI on it, a training program which was really due because of the lack of available avenues. And over the years, this program has turned out to be the go-to place for all orthopedic graduates, and everyone wants this ASSI fellowship. And the number of people who apply has significantly increased, and we are now shoulder to shoulder with any other fellowship program anywhere else. Now, with power comes responsibility, and it's our responsibility to now raise the bar and make our fellowship program really, to the next level. And that's really where this meeting is leading us into. And we have the head honchos of the ASSI who will be able to make decisions based on today's recommendations. And the guy who's done the heavy lifting so far, Dr. Harshal Bam, I hand over to you to take over proceedings and introduce the speakers and take it forward.
Thank you, sir. I welcome you all for our Spine Fellowship Alumnus Forum. This is a final session where we are going to have two mentors speaking the fellows' perspective. And then we'll have a panel discussion with all the esteemed faculty and panel which we have today with us. The first speaker is going to be Dr. Agnivesh Tikku. He's been a mentor to me as well. And he's done his FNB from Hinduja Hospital in Mumbai. And he's currently a consultant at Apollo Hospitals in Navi Mumbai. And there is no need of any further introduction because he's well known. And I'll just hand over to Dr. Agnivesh Tikku.
Thank you, Harshal. Thank you, Nene sir, and thank you to the senior colleagues and faculty. I've been given this opportunity by Nene sir. I'll try to do justice, and I hope that at the end of this session, I don't get sort of beaten up by my mentors for saying on behalf of fellows. But it is both way. Am I audible? Sorry, am I audible?
Yes, sir, you're audible. You're audible.
Okay. So, so the topic today is slightly, and not slightly, very difficult to sort of speak on, but we know that only the wearer knows where the shoe pinches. So now slowly getting into a role of mentor, I know that what are the challenges a mentor faces, what are his expectations, and where do we sort of what we require from the trainees and all. And it's not an easy job. There is absolutely no sort of words to it. But I am going to speak today from a fellow perspective. And by speaking this, I do not denounce the struggle, the stress, the sort of the greatness which a mentor takes to teach the trainee or the fellow. But it is going to be a perspective from a fellow's mind only, and ask some questions which I think that probably if we address them or if we think over them, maybe we'll make our fellowship or our sort of interaction or our life a better place. So before going to that, I was reading an interesting article from the none other than great Einstein, when he wrote a letter to Max Born and asked a question, which is one of his favorite quotes, is that, does God play dice? So when he sort of asked this question, what he meant was in terms of quantum reality and quantum world. And he was suggesting that God does not play dice. It's not the choices which he makes, it's the randomness in which the God is there. And this led to a very famous book from Ian Stewart, another great physicist, coming. And it was challenged subsequently by Stephen Hawking, where he said that not only does God play dice, but he sometimes throws them where they cannot be seen. So because of this randomness, we all know, being a true believer, I know whatever happens for good. Whatever interaction between a fellow and mentor is there, whichever way it goes, it happens for something good. But to the great sort of story about Eklavya, where he is asked to cut his thumb by the great Guru Dronacharya, so that he sort of cannot surpass somebody he didn't want to be surpassed as an archer. But when we stand face to face with our trainees today, or when a mentor stands face to face, or when a trainee stands face to face, can we compare all the mentors to the Dronacharya? Are they as great? And can the learners be dedicated, can be considered? Can, can the learners be considered as dedicated as Eklavya? Probably in today's world where things have changed and a lot of things have passed as compared to previous generations, where the initial struggle was to earn food, then probably to the generation where I belong, we were not so much worried about food. We wanted a better life, to now where life, better life and all is there. And people just want comfort. It's a general trend which has been changing everywhere. So the only question which I want to ask is that how can we make best of our times together and contribute to each other's betterness? So when coming back to the same question that does God play twice, that when we exercise a choice to select somebody for a particular sort of project or something or training, are we disturbing the chaos of the universe, or it is better to sort of equally distribute it and see what happens? Somebody we especially expect that he's not going to be able to do this may astonishingly do good. When we are exercising our choice, are we sort of disturbing this chaos of the universe? The second question is that training is an equal responsibility of the mentor also, because we know that trainees have to be responsible. There is no question about that. You cannot learn unless you are responsible. But if a mentor is not doing certain procedures, or if he is not doing certain sort of procedures, it is his responsibility to get him trained in that procedure by referring him to a colleague of his who does the procedure, or at least have an exposure and let him decide whether he feels that this procedure is good or not. A larger question which I believe will be asked also is financial. We know that as medicos and in training, we are generally underpaid. So now when we are talking about a fellow, we may understand that it's a training sort of post or a perspective. But when you compare his life to a person who was a non-medico and he started 10 years along with him when he completed his sort of pre-university exams or 12th board or whatever we want to call it, so where he is in those 10, 11 years and where there he's earning, because nowadays it is not only a comfort to have, but it's a basic necessity to have a good living and financial. And we all know that our in the PG days and all, the doctors are the one who are actually very prone to falling sick because of sort of the conditions where we live in. So can we make it slightly better? Then when you have a lot of trainees under you, and are there some favorites? And sometimes do we sort of get more inclined towards one person, and in process of that we neglect somebody who wants more, sort of who is capable of doing much more, but we are not able to see it because of that. Even parents have it. I am not blaming on anyone. Even parents have it. Studies have shown that more than 70% of parents have a inclination or a preferential treatment towards one child. It's not only mentors, but it's a general human tendency. And one important point which I feel is that there should be a periodic one-on-one meeting with the trainee. Just passing by him in the corridor, or just in 3-4 people asking that, are you doing well? Is it okay? It's okay. He will probably not speak up unless, if you feel something is going wrong, you call him into the room. I am sure a lot of us will be doing that. But if he should, as a part, have a periodic one-on-one meeting with the trainee and understand what his needs are, what his aspirations are, and we should encourage them to speak up for their aspirations. And probably prefer a multi-surgeon training, and that will be the best for any person. It can be inculcated even in certain sort of places where the trainee is tied to one mentor, but I'm sure that he can make best of his time. And especially one important is neurosurgical training, that we as a sort of spine surgeons do need to have neurosurgical training, and a formal neurosurgical training where you sort of open up the dura, close it, and that's how the fear of handling the dura and all goes away. And one question which I want is always wondered, and this happened because I sort of was in a situation where I was asked to review my employers and said that you give the feedback that how we are doing. So if if somebody is asking a feedback in a way that you tell me how you're doing, so is the feedback real feedback going to come? So as we have double blinded trials, can we have a feedback system where we do not, some independent person is sort of assessing or comparing the feedback, and maybe that person may not be the same colleague or something, but it should also involve some other profession people who can independently assess that how he is doing. Because one of the problems which I feel is that if you give a feedback to a colleague of your trainer, of your mentor, then the trainee will not speak that much, and it may be taken in a wrong way also. Thank you very much.
So very critical inputs, Agnivesh, and I think I love the way you put the whole show together, and only you can do that. We need more high IQ mentors and ex-fellows like you. Any immediate thoughts by anybody in the house on, because there were some very, very important points, especially about, talking to the fellow one-on-one, which we often tend to miss. Raja, do you want to say something? You've unmuted.
Abhay, I don't know, Tico was very frank, and I think I'll appreciate him for that. So I think you should also allow me to be a little bit more frank. So, this is the days of entitlement. So when I was listening to Tico, I was just thinking what we felt when we were as trainees. And we were thinking training is a blessing. We thought training is something that we were not entitled to. I would use this word entitlement because I find this as a part of all the trainees. So they think, okay, if I write the ASSI exam and I get selected, and automatically it doesn't matter. I go to Basu, then Basu must keep a red carpet welcome for me. He must throw red flowers at me every day. He should spend 2 hours with me every day. He should teach me everything. He should ask me to write a paper and spend sleepless nights in training me. And, it's that, okay, if Basu is not doing some surgery, then Basu has to take him and leave him with Samir Dalvi and then send him to Sudhir for C1, C2, all these things, So I think sometimes I get a little bit worried at this feeling of entitlement. I'm not saying that trainees should not be trained very well. And, but I think that whole discussion sometimes goes off one way. Now let's look at what happens when a trainee comes to an institution, and are all trainees the same? When you are going to evaluate all the trainers, are all trainees the same? I mean, we get 10 trainees a month, a year, and we find from angels to devils, we have all of them. So does that give us the right to all call of them and say, okay, from next month, you are no longer a trainee with me? No, it's not like that. I mean, it's just that you need to know that training is a process. And in the process of training, every trainee has to understand that he is actually the person who has to be obliged to the mentor. I mean, I just somehow find that I'm sorry if I am just looking very much brash on the other side, but I just want, this may be in the mind of most of the mentors, but they may feel a little bit shy of telling that, but I think I've crossed that stage of being worried about telling this. Mentors have passed through a lot. They have built institutions. They have their own responsibilities to their patients. They have responsibility to the whole system, and everything is there. Just because somebody passes an exam and just steps into your institution, you just can't expect, okay, I am ASSI fellow. I need this, I need this, I need this, I need this, I need this. I somehow got the feeling from Tico. Tico, I have nothing against your talk. I really enjoyed it. I enjoyed the first 5 slides more than the last 5 slides. So it was very good introduction. So all that is pretty good, but I think there must be a balance. Whenever the balance tilts in favor of the people who get and not the people who give, I mean, you will always find that the system fails. So I think there must be somewhere where in all these discussions, people put a balance to it and say, okay, there are some responsibilities of the mentors, but what about the responsibilities of the mentees? So there is a huge gap in the way that I see the mentees' responsibilities, the mentees' involvement, and the mentees' attitude. All these are also quite changing. So why don't we discuss about that also? I mean, I think this is really one-sided.
So when we do have a mentors union, we know who's going to be our captain. Dr. Basu and Dr. Sajan, I want you to come back here as a, as a counter to this, not as a counter. All I'm saying as a devil's advocate to what Dr. Raja said, that once, because you all were the two guys who initiated this ASSI fellowship program, I'd like to ask you that when we submit ourselves to be mentors of an ASSI fellowship program, going through all the checklists, the ASSI has not caught you and said that you have to take a student. Aren't you subjecting yourself to that amount of scrutiny because you've yourself signed up for this? Yeah, Raja. Yes.
Before even Shajan starts, okay. Abhay, just not to be misunderstood. So it was during my presidentship, I really pushed hard for this ASSI fellowship and got it done. I mean, I got all the traveling fellows, the ASSI fellowship. So this ASSI fellowship is very close to my heart. And we have FNB fellowship, we have ASSI fellowship, we have the Tamil Nadu NGR medical fellowship. So I'm all the time looking at how to have more fellows and train more fellows. But it is just that I don't want discussions to go on mentees' rights. When you're only talking about the mentee should have this, the mentee should have this, the mentor should give him this. If there is no problem, if the mentor is not doing the surgery, send him to another mentor. It is just like, okay, I am dropped down from the heaven. I just passed the ASSI exam. And right now, in 2 years' time, it's the duty of ASSI to get me into the best slot possible. You do everything for me. I will just do this and all that. I totally, I'm not on a popularity contest over here. But I also don't want to be misunderstood on what I am saying. I know that many people feel this in their hearts, but I just want the whole thing to be really balanced.
Totally get your point. But just to initiate the discussion, Dr. Basu?
Shall I speak after Dr. Sajan Hegde being
yes,
the
sure,
junior
sure.
member?
Dr. Sajan is likely to overshadow everyone, so I thought we should let him have the last go. Dr. Sajan, what do you feel about this? Are you on the same page?
At the outset, I fully agree with Raja that we as mentors are giving a huge opportunity to the younger generation to learn from us. So one has to look at it from that angle. It is not the mentee demanding, okay, what can I get from you? It is rather the mentor, what he can give to the youngster. Having said that, the ASSI fellowship is essentially one of giving 2 years of training in basic aspects of spinal surgery. Now, there are quite a few who would like minimal invasive surgery or an eye on neurosurgery, or somebody would like to be involved with a vascular surgeon or a thoracic surgeon. Now, these, depending on the individual demand and the requests from the youngster, the mentor can arrange either within his own setup or outside. For example, I can arrange, if one of my juniors wants to spend time with the group of neurosurgeons, very easily done. If he wants to learn a little bit of thoracic surgery, very easily done. If he wants to learn vascular work, also very easily done. So these are things that are add-ons. These are not things that we are expected to give to every fellow. Every fellow has to learn the basics. They come mostly from centers where they have not been exposed to spine surgery. So the mentor's brief is to train them to be reasonably comfortable in doing most of the routine surgeries. Anything beyond that is a bonus for the youngster. Now, if they want to go to other centers or exchange amongst other mentors, this can be easily done. They want to see how Somajit does his scoliosis, very easily done. So, or go and see the wonderful work Raja is doing, very easily done. So these are things we can arrange, but these need not become part and parcel of the 2-year training program. Our brief is very simple. Train them to become reasonably good.
So we get the drift, and I think Dr. Raja has led the way on this.
Why the silence?
Sajan, you're breaking up. Yeah. So you largely agree with this thought process. Yeah. Dr. Sajan?
No, I was wondering why there was a silence. Everybody seems to have gone into a maun breath.
No. You broke up. Suddenly your connection went off.
No, there is a respectful silence every time Sajan speaks. Yeah.
Dr. Basu?
So, Abhay, Tiku was one of my initial fellows for the first. He is definitely within of my first 5 fellows, and enjoyed his time with me. And whenever I have met him up later on, after he became a consultant, he's always been very, very nice and respectful to me. Enjoyed your talk, Tiku, but at the same time, enjoyed Raja's feelings and enjoyed his thoughtful maturity on the subject tremendously in the last 5 minutes. If I consider myself as somebody between Raja, who actually I could consider I myself have been trained with SR, if I might be allowed to say so, because on various occasions I've followed him very closely in his surgeries, in his Ganga hospital courses. And if I consider myself between Tiku and Raja, I would definitely agree on Raja on one point. That is, when we were trainees, I would never have dreamed of going to the UP if I had the similar sort of training process in the country in 1997. Similarly, when we went down there, we were gobbling up things. I mean, thankfully, in those times, the working hours per week schedule was not there. So I hardly went out of the hospital just to take some hours of sleep, or somebody spent the entire day in the hospital and night in the hospital. So we were gobbling up things because training was not available at that point in time. And today, training galore, opportunities galore. So everybody is having a few fellowships in his pocket before going on into another. So that means they become sort of much more demanding on, I would have got this much if I had gone there. I would have gone this much if I would have stayed back there and all this. So this comparison, all this comes in when you are served the dinner on a platter and when you have enough things on the buffet menu. If it is not there, you will definitely gobble up if you are hungry, whatever is available on the plate. For example, when I go to a Ganga operative course, I consider myself as a trainee. I have had the very good fortune of getting to demonstrate surgeries as a consultant. But believe me, whenever I'm not operating, if Dr. Raja has seen me and Ajay has seen me closely, I tend to hover around the OT and tend to spend some time with Anand, who is sitting with 5 computers, getting all the OT feedbacks into one console. And so that I basically take that as an opportunity to train myself more and more. So as Dr. Raja correctly pondered, it's a continuous process. But again, Tiku, we also need to realize that whatever facilities is sort of high on demand, that cannot be always obtained, because, to repeat, training is a continuous process. You can't consider these 2 years to be financially well off, to be training-wise well off, to be hours-wise well off. You would get time for the family, you would get time for the hospital, you'll get the cream of the work delivered at your doorstep. This does not happen. So in reality, it is always a balance. Over to you, Abhay.
So again, important inputs. And Agnivesh, quickly, can you unmute yourself? Because we don't want...
Dr. Raja wants to say something.
Yes, of course.
I'll come later.
Just a quick input from Agnivesh, because
Yeah,
you know,
sure. Let me.
let it not be that he's just being
no.
bombarded by, because he's actually a mentor now, and we had actually asked him and then Vishal to follow, to bring up these points and get the white elephant into the room, so to say.
Raja
So
sir is smiling. Raja sir is smiling already. Vishal, Vishal to follow. The next to be bashed up on is Vishal already.
No, after Vishal, I don't speak anything.
yeah, we thought we'll get Agnivesh first, and then because Agnivesh is softer and Vishal will just come hard at everyone. And so Agnivesh, you, then Dr. Raja and Dr. Samir also wants to say something, which I guess is going to be aggressive also. And Dr. Ajay. Agnivesh, quickly.
Sir, right at the first outset, I said that I absolutely agree now, being now moving slowly into a mentor's role, that what are the stresses and what are the things of mentor. The people who are in this panel are much more experienced than me, and I can only imagine what they must have gone through during their days and all. So I know I'm sort of a different speaker over here, but the aim was to put it from a fellow's perspective. And absolutely hat off whatever Raja sir said, whatever Basu sir said, Sajan sir said. So absolutely agree with all of the points. I do not disagree, as and when I'm realizing it more and more. But yes, it was because I had been given that task, so I sort of put across that what I felt was needed. Yes, things cannot be given on a platter, and even if you give it to the platter, somebody whose destiny is not that to take it and learn from there, he will never go across it. It is only the one who has that ability and who has that sort of learning sort of zeal or that enthusiasm, he will only go through. But yes, this is somewhat to introspect on our parts, that can we make it better, or would this way be better? These are just points to think and ponder upon.
Totally get it.
So,
yeah.
Abhay, you gave me a minute, so let me do it. So when you struggle hard for something, you are grateful for everything that you get. So when you get it on your plate, then you start complaining about everything. So if you have to struggle very hard and earn a food or a dinner, then you're grateful for whatever you get as a dinner. Now, if you are taken for a treat to a 5-star hotel, then the soup could have been better, the waiter could have been better dressed, better. Why not my favorite dessert? When I am coming, why didn't they cook my best chicken? Why this didn't happen, that didn't happen. So this is exactly what is happening in these fellowships. So ASSI, gets a lot of money, and then we set up the fellowship, or we set overseas fellowship. Sometimes I have found the guys who finish and then go for an overseas fellowship and they come and complain. Oh, this didn't happen, that didn't happen, this didn't happen, as if the world should be waiting ready for them at the overseas. So this is completely, I'm just overboard today, but I know that I'm just going on a wrong overspeed, but I just want this to be really true. When something is served to you in a platter, and that's what's happening to all the fellows nowadays. They just have to write a small exam, and then the world has to open in front of them. I mean, if you want to learn neurosurgery, why don't you go for 6 months more for a fellowship to learn neurosurgery? Why it has to be that 2 years that you spend with a mentor, that you have, it is his duty to train you also in neurosurgery. So it's not like that. I mean, it's just like a daughter-in-law coming into the house and saying, why is the sofa not my favorite color? Why is the dining table square when I like round dining tables? Why is morning dinner not that? Why is my mother-in-law not serving me? Father-in-law is not giving me water and all that. You don't need, you have come for a training to an institute. You have chosen the institute. Everybody has got their ups and downs, plus and minuses. So in that 2 years, you have to learn a lot, what you can learn from that mentor and that institute. And then move on to another institute and learn whatever you want. I think it's total, this English word called entitlement is what can be described for the attitude that, okay, I have become your mentee. I am sitting on your lap. You have to do everything for me before I finish. And what I need, you have to make me at the end.
Lovely.
Abhay, can I?
Yes, please.
So I think, with all this bombardment from Raja and everybody, which I completely agree with, because that's how we came through, But what I want to say is that what we need to do is, as mentees, I mean, when we means you need to do the mentees, you need to understand what is you need to have a different attitude to a fellowship. This is not an MBBS or an MS, or this is not a 12th standard exam where there's a curriculum and a lectures and you're taught and you study. No, a fellowship, spine surgery is a craft, an art, it's a science, and it's a profession. It cannot be taught in a curriculum because it cannot be. A fellowship gives you an opportunity to live the life of an established consultant for 2 years. And in that 2 years, you have to pick up as a sponge what best you can. It's not going to be pushed into you. You as a sponge, suck it into yourself. And that's the way you learn. You are going to get only if you give. You are not, it is not passive learning. It is active learning. You see what the guy does. Even if you're just assisting, you don't do a single case. You assist me for 150 microdiscectomies and don't do one. You should be able to do the next one. And don't expect a curriculum. Don't expect that. I am living for 2 years, right? That's how I am practicing. That's how. So in case you have to run to 4 hospitals, I am also running to 4 hospitals. If I'm finishing at 11 at night, I am also finishing at 11 at night. You want to become me, right? So you jolly well do it. You can't say you want fixed hours. You can't say you don't want to run around hospitals, because that is the life. And whatever is the life, if you are Abhay's fellow, you will go for one beer party every month. That's his life. He works hard, he parties hard. That's what you absorb from him. If you're with me, you will see me being tough to patients. You'll see me being ethical. That is me. You pick up those things from me. But those 2 years you spend with me to learn my craft, and that is how you model yourself. Don't expect to be fed with a spoon. Don't expect to be put on a platter. And I have had fellows for the last 10 years only. Maybe I'm one of the junior most guys, FNB and ASS. And I see how the same training, but some guys have gone right up there and some guys are in the middle somewhere. They've all done well, no complaints. But why? What is different? I have not done anything different. It's the way they have made use of the fellowship. Why does one guy have 8 publications and one guy has 0 in the same unit? In the same unit. So this is where your role comes in. If you are good, if you work, you get. If you impress me with your surgical skill, if you drape well, if you position well, I'll give you to expose. If you expose well, I'll give you the laminectomy. If you don't, I have better things to do. I'll just come and finish the case, right? So that's the main point. You guys put in your input, you can suck everything out of the mentor. Have this attitude. Don't expect to be fed. Don't expect a curriculum. Don't expect that, oh, I want to learn this. You live my life for 2 years and you go out and go into the world. That's what I feel.
So great points again. And Ajay, do you want to say something?
I just want to clarify the issue on the stipend, because the issue came actually when Basu was a secretary, and he made it uniform that 50,000 rupees is the stipend that the SSI fellow will get. And it also followed the pattern. Why the North Indian people get more is because if you look at FNB, the FNB doesn't say it's a uniform stipend throughout India. FNB does say that the stipend should be as per the resident listing of a particular state. Like Tamil Nadu, what is the state's resident does get it, that's the stipend that the FNB says. FNB doesn't say that in Delhi you get so much, the same thing should be applied to India, because that's how the stipend system in India is. Unfortunately, when I did my fellowship, which was much lower than what, when I did my post-graduation, which was much lower than what somebody gets in Delhi. And that's why if you see a lot of states are fighting for stipend high. But here the issue comes, what we have followed in ASSI, thanks to Basu, that the stipend was universally made compulsory, that it remains the same for all centers. Certain centers in Delhi might have given more, matching the FNB requirement for that particular area.
So this is again an important official point, which I think we'll come across a little later about the differentiation in the stipend. So I think a healthy discussion has moved on, and all the fellows in the group, I can see a lot of them. Hriday, I can see you, Kushal, Rohan, recent fellows or past fellows. Please, don't unabashedly put your hands up and say anything that you want to, because this is an open forum, and this is vast turning out to be a one-sided affair. So it'll be good if you all can put your point across. But we have a speaker on your behalf who, has been shining bright in the academic circles of the Indian spine community, and Dr. Vishal Kundani, who in a way was one of the earliest, or maybe the first ASSI fellows, has a lot of inputs in terms, he always has an opinion, has something nice to say about everything. And he seemed like the next good guy to voice out what he feels as an ex-fellow and a current mentor. So Vishal, it's over to you.
Thank you, Dr. Abhay, and thank you seniors around here for giving me the opportunity to share my. In fact, as a matter of fact, today I finished 14 years in Bombay. When I stepped into Bombay to start my fellowship program here was 2007, when I remember Dr. Abhay and Dr. Raja spoke about starting ASI TB registry, and I was appointed as the first ASSI AG'd fellow to start a TB registry work here. And I take this opportunity not to bring out the rights of mentee, neither am I going to push forward to the responsibilities of mentors, but I'm going to bring about a structure which I envisage and dream about, that tomorrow, if I have to go back in time and I have to rejoin my fellowship, what are the changes I would expect in the fellowship program? And I think if I get that kind of structure, I would be even better than what I am today. I have no regrets today, but I'm sure it'll be an outshining thing if I get all the things that I'm going to come up with. But just to bring about the definition of what a fellowship program actually is, let me bring out this definition, which has been programmed in multiple papers, and now Canadian Society of Spine Surgeons have already made a definition of what a fellowship program is. It's a multifaceted training program to adopt a professional who's already a professional by an academician to transform him or her into a better professional with empathy, skill, and credibility. So you're basically trying to create a better academician, better professional based on whatever knowledge they have, and to create a person who can, with his credibility, emulate the empathy, skill, and credibility of the mentor there. And all this in an emotionally optimal and academic environment, while holding the hand to create a legacy so that the future of fraternity is given in the safe hands. The question is, today, do we really have a program of that sort? And if it is there, I would really want to rejoin. So how do we make such fellowship which is futuristic, idealistic, and yet realistic? I'm just going to bring out some 10 pointers which I really envisage. And I'm as a matter of fact, also going to bring out some literature reviews on how do we really try to accomplish such fellowship program for future, where everybody of us would want to rejoin back in the same environment. So how do we ensure the best outcome of any fellowship program? To fill in the definition of fellowship, let's have the right centers and the right mentors. How do we do that? Canadian fellowship guidelines mention that the right center is one where minimum 250 surgeries are performed a year. Any center which has less than 200 surgeries performed have created surgeons of competence, which is less than the surgeons who have seen 250 plus surgeries in a year during the fellowship. The ideal constituency of a mentor to mentee is 2:1, but 1:1 is the bare minimum. One mentor can easily have 2 or 3 or 4 fellows, but the best is when you are 1 mentor to 1 mentee. There should always be a possibility of rotation among the team members. If there are less than 2 team members in the same hospital, it's a good idea to have a city rotation. I got the opportunity while being at Hinduja Hospital to go to Leelavati Hospital, observe Dr. Bhojraj, to go and visit Dr. Vijay Lahiri, and I really, really cherish those moments. My learning has really improved when I visited them to see a different prospect of similar surgeries. And having an in-house neurosurgical team, it gives you a better prospect of problems which we generally tend to fear while being into a fellowship program. Of course, research should be an integral part of the institute where fellowship is going to start, and the number of papers should not be the only criteria coming from institute, but also the academic contribution in the form of organization, publications, presentations, research happening, whether published or not, should be taken into account. And one such institute should constitute an ideal center of excellence or the training center from ASSI or the organizational body. Now, I really feel that anything less than 2 years is absolutely a no-no for any fellowship program, because by the time you settle in as a fellow, 3 months, 4 months have already gone by. And it is proven by AO Spine Group also, which has shown that any fellowship program less than 12 months creates surgeon of less competence than those who are more than 12 months. An ideal program is either more than 12 months, and the best is 2 years, when the last 6 months should be on the assessment basis, where problem-based learning should be promoted among all the fellows. And short-term observership should be purely restricted to people who have already undergone a specific kind of training and are coming for a specific procedure to a specific institute to learn and improvise upon their learning for the future. Now, yes, there are curriculum which is already been made by various organizations during fellowship. However, it has to be made structured and comprehensive, which is staged in 6 monthly or in 3 monthly intervals, which is followed disciplinarily. I mean, there has to be a structure which is for first 3 months, this is what is there. Next 3 months, this is what is there. Next 3 months, this is what is there. And the best could be if we can utilize in this era of technology-driven virtual fellowship program that can come across, if we can utilize the pre-joining period to enhance the knowledge. If we cannot enhance the skill of the surgeon in pre-joining period, at least the knowledge by theory at home, pre-recorded lectures at home, and of course, surgical exposures at home, covering basic and advanced topics, giving practical tips of what you are going to see during your fellowship when you join in the first 6 months, 6 months and 12 months is something that would really be ideal to use the pre-joining period for these fellows. And I would really love to have seen my fellowship program. If I had known the end point of my fellowship, I would not have been at lurch at the end of it. If I know right at the beginning, even before my joining, if I had a predefined learning objective that I'll be able to differentiate between conservative versus surgical patient, these are the type of surgeries I'll be learning at the end of 6 months. This is the type of surgery that at the end of 12 months, I should have known a particular kind of surgery at the end of 2 years. I should have been knowing this deformity surgeries to be performed in this particular manner with the nuances of surgery. If I had known the end point of 6 monthly fellowship tenure, my performance would have enhanced while I am still undergoing my fellowship. And this performance enhancement can easily be made very, very objective if we had predefined learning objectives or outcomes which are given to the fellows right from the moment they are selected for the fellowship program. And not only these learning objectives are predefined, but also there is a trainee perspective. So at the end of 6 months, the trainee is given an assessment sheet or a record from the mentor and telling him that you are not good at TLIF. For example, if we expect me to perform a TLIF procedure at the end of 12 months, if my mentor tells me that you are still not the ideal one to perform a TLIF procedure, I would want to learn here and I would want to reshape my fellowship, or I would want to rechange. Or for that matter, at the end of 12 months, my mentor feels that this guy is really good in TLIF. I don't think I should waste his next 4 months into making him learn those basic procedures. He could actually advance and there can be a performance enhancement. And that is why trainee perspectives from the mentor and also getting the trainee's idea also of what is that one procedure that you would really want to learn at this stage of fellowship, maybe at 6 monthly interval, to change this structured discipline comprehensive program will really help us to shape even better fellowship programs. And this can happen at a regular interval. It necessarily doesn't have to happen at a 3 monthly interval, but at the end of 6 months, maybe a trainee letter of intent to understand what is the specific thing that he's more keen to learn from here coming forward in the next phase of his fellowship. This fellowship has to be totally hybrid. Now, I have been trained in Bombay, where I was in a corporate hospital where a lot of early tuberculosis, early deformities were being taken care of. MIS was a part of my training curriculum, but when it was rigid deformities, severe deformities, or for that matter, very severe kyphosis, it brought a flash in my eyes, and I really got worried when by the time I was out of my fellowship program. And to fulfill that, the next 6 months of my fellowship, I actually went into KEM to observe this. So if we can have a structure where all the fellows get a chance to observe government institutes, also to have a complete flavor of what he's going to see in the rural area, because rural spine problems are completely different from urban spine problems, and the type of patient that you're dealing with is also completely different. So having a hybrid training program where there is a small rotation happening from private to government institute and vice versa, from orthopedic to neurosurgery and vice versa, and also to centers which are specifically specified in specific kind of surgery. For example, there are certain centers, even in city of Bombay, where MIS is more, where deformity is more, where pediatric deformities are more. If we can have our fellows rotating there, even if it is for a short period of time to observe for 3 or 4 weeks in their structured program, that will be really great. And of course, being an intensivist in this era where you're going to be seeing more and more problems with intensivist, rehab, and physician, making a comprehensive surgeon is something as small as a 7-day posting in their curriculum would really shape it into the best curriculum that we can ever shape across. Yes, there are already objective guidelines from the United States Spine Surgery Fellowship Program directors that at least 6 to 8 hours of theory per week should be given to every single fellow, be it in the first 6 months, next 6 months, or even in the last 6 months of the fellowship program. And at the same time, there has to be outpatient departmental work for at least 14 hours a week that a fellow should be subjected to. So this is something that, like micromanagement, depending on how and where the fellow is posted, but this is something that has been able to create a competent level of fellow. And of course, grading the type of treatment options that the patient or the fellow is going to be seeing with the patient, something that we can further micromanage these fellowship programs based on the guidelines that are coming up already. And of course, at the end of 6 months, if somebody has been doing lumbar surgeries or has been observing lumbar surgeries, rewarding them in time will be a sense of entitlement given to them without really giving them the right, but it is like gifting them that entitlement when they really come. And of course, to decide when to reward them, there has to be some kind of assessment, which I'm going to share in a minute's time. Now, we have seen that there are certain institutes in the country from where the fellows try to boast of being the best fellows of the country, whereas there are certain institutes in the country where they feel little, on the back foot because they have come from an institute where either the volume is less or the technological advancement is less. And this is purely a sense of a complex or a comparative complex that happens in fellows. Me, I being in Bombay, I was probably on a superior side, whereas my guys, my friends who are sitting in, say, a second tier city doing the same fellowship program probably will have a sense of inferiority due to whatever kind of structure that they have followed. The idealistic situation would be when we have a uniform curriculum across the nation, where Delhi guys, Ganga guys, Bombay guys, Nagpur guys, Ahmedabad guys have the same curriculum, same kind of structure of following the thing with the exact level of micromanagement and exact level of enhancement happening there. On one hand, we create uniform people, uniformly knowledgeable and surgically skilled people. On the other hand, to develop the future of spine surgery, if the mentors can catch upon those guys who are really excelling into a particular field and give them exclusivity, handhold them to future to create more specific branches of spine surgery. Like we already have MIS surgeons, we already have endoscopic surgeons. Why can't we have deformity specialists in India? It's already happening in the West. Why can't we have CV junction specialists in India? And that kind of structure can be created. And this is something that will not only create better future prospects for those fellows who are getting into exclusivity, but also will develop the institute as a whole. Contributions from these fellows can be then taken into consideration. And of course, a all-round development. We are, on one hand, we know that the development of knowledge and surgical skills is paramount. However, there are enough number of papers that a good knowledgeable surgeon may not necessarily be a good surgeon, and vice versa is also true. And there has to be a comprehensive development. I have been really lucky to have been visiting the more modest Dr. Mihir Bapat and the more aggressive and charming Dr. Abhay Nene. And at the same time, I have seen a visionary like Dr. Bhojraj in my fellowship days. And I also seen Dr. Samir Dalvi, who's very, very precise and very, very up to the point there. Being a club to these surgeons, I have learned it. But the best would be what Norway follows today is PBL approach. Like tomorrow, if my mentor has a problem, he just throws open this problem to the fellows and gives them a specific time frame that come up with ideas. It's like training and creating a IAS in the spine fellows, churning out their thought process. That is a problem faced by a surgeon, be it a organizational, be it running an institute, be it running an academic program, or be it a surgical training program, or be it treating a particular kind of patient, discussing a problem case, anything, any problem that the mentor is facing, throw it open as a challenge to the fellows there and allow them a deadline to think about it and come up with solutions about this problem and incorporate this for the future learning program. This is something that will create and promote more creativity, allow them to think and create a more comprehensive level. I also remember Dr. Nene, when he was my first mentor there, he promoted me to go and do a personality development and public speaking course, which probably at that time when I was not such I was a little shy. Yes, I am little low in my communication skills even today, but I think this is something that all mentors should promote their fellows to go and join some kind of communication skill, personality grooming, empathizing skills. This is something that is extremely important. And like AO creates a faculty training program, why can't our fellows also have a small teaching skill program happening at the end of after the exit exam is over? Maybe they can go through this teaching skills to create more teachers in the future, really shining it out for the organization that they've come up with. Now, how do we create rewards from them? I think assessment cannot be only like an exit exam. We can't really judge a fellow's 2 years hard work learning, which is on a predefined curriculum purely based on his performance in an exit exam. It has to be comprehensive. It has to be at a regular interval, and it has to be modulated in the form of a feedback. Why filter them out at the exit exam when we have already filtered the best of the best lot at the entry point? No IAS person after his training is subjected to another examination after completion of his 2 years of IAS training program, or a IPS for that matter. So why fellows have to go through an exit examination? We can have a comprehensive assessment, and we really need to develop these tools which do exist. There are tools to assess not only technical skills but also non-technical skills of these fellows who have undergone this curriculum program, and such critical feedbacks given at regular intervals. Say for example, at 6 months you will go through a critical feedback from the mentor, and these will provide good improvement zones, which may be on theory basis, which may be on practical basis. For example, if I got a feedback at the end of 6 months that you don't handle the dura well, you need to really work on that, handling the dura, or you are not doing good end plate preparation, you need to work on that. So at the end of 6 months, I would probably want to improve myself, because this is the feedback that has come to master myself at the end of 12 months. So this is something that has to come across. And all this, while I receive a feedback on a daily basis or at 6 monthly It has to come up with a understanding that I'm not going to fail. I'm only getting a chance to improve. And this can happen when it comes in a cordial environment where there is a habit building guidance coming from my mentor. I know that my mentor is telling me to improve upon certain things by giving me critical feedback, rather than there is a sword on my head saying that I don't perform, I will be failing, and or there will be a 6-month extension to my exit examination. This is something that we all need to work upon. Yes, there is uniformity in the financial support. It's a very subjective thing, what is optimal, and I think there is no balance between what is going to be optimal. But the basic minimum, I think, is to support the family of these fellows, to allow them start their families early and give them the accommodation that is the bare minimum, because this is something that is very important, allowing them to have family support while they are going through the training, because this is something that will promote them to learn further. And this is what has proven even in US, where they have in-house accommodation, which really helps these fellows. And if this is something we can really incorporate, like IAS guys, after training, they know they are going to have a posting. If our fellows can be developed or nurtured into some kind of posting, even if it is a small posting, to reduce their struggle years at the end of their fellowship. 90% of our fellows I have spoken to have this concern in their mind: what will I do at the end of exit examination? Will I have to start struggling marketing, get into this world which is so competitive, ambitious, and fight my own mentors to get my own patient base for myself? I think this is something that we really need to work upon, to handhold them into this competitive world. And we are not trying to spoon feed them everything. We are not going to give them everything what a consultant or a mentor has. But I think handing them certain benefits of being an exit examination and giving them this opportunity during their struggle years after the exit examination will make it more meaningful, and yet keep it competitive without pushing them into cutthroat ambition. And this can happen by following this expertise model after the exit examination is over. So with this, I would like to sum up that I will surely want to rejoin such fellowship again and bring the best in myself again, and bring out the best of myself based on the assessments that are given to my mentors in more optimal environment, while a hybrid training program happening to me in a comprehensive holistic development for me. Thank you so much.
Lovely, Vishal. That was absolutely to the point, and you brought across a number of points which we will now spin across into the discussions. Harshal, you can take over.
I just wanted to, Vishal.
Yes, please. Yes.
You forgot last slide actually. I think the last slide should be at the end of it. If the mentor has daughters, then they should be given in marriage to the fellow. And if he doesn't have, then he should adopt the fellow. Because that's all that was left in your dream program.
Yeah, I wish so, sir. I wish so. Yeah. Or maybe you can get as a girlfriend also. One of you.
No. The surgeon, a spine surgeon, has to adopt you. After pampering you for 2 years through all of this, abhi utna hi baki hai. Anyway.
Yeah, thank you, sir.
A strong lobby from the mentors. It may be a good time, Harshal, to get some, specific points here.
Yes, sir. So, as the idea and philosophy of this program was told initially also by Dr. Nene, at the outset of this panel discussion, I would like to again reiterate that this program was basically made to get feedback from the fellowship alumni, get a constructive criticism from them if any. And we had 10 speakers who spoke about it, and I'll assure you, sir, they were all grateful to their fellowship program. They told about their journey. They told about their evolution into spine surgical field and education. And all of them had very high regards to their mentors. But we took up this panel discussion because they had a few suggestions, some genuine constructive criticisms, and we wanted all the esteemed panel which we are having here, all the patrons and sympathizers of ASSI, to give their opinions and find out the scope that how this feedback can move into betterment of the fellowship program, sir. Yes, Saradhara sir, you wanted to say something?
Yeah, actually, I want to say some 2-3 points. Each fellow provided with some structure, the outline, in the course, how much surgery should be done in this, everything. And every fellow was interested in that number only. I think number of surgery is important for their exposure. Decision making, what to do, when to do, that part I think we are lacking in our training. That is because of many times a time period problem or something. So decision making, because they are going to do their private practice after fellowship or this thing. They know what to do, when to do. That is more important than how many pedicle screw they inserted. So that part is lacking in my institute, that training, one thing. Second thing, before selecting the fellowship, each and everyone have a choice, their own choice according to their interest. But still, every institute has some positive, negative parts. In our institute, we have a lot of case of trauma, degeneration, tumors, everything. But minimally invasive, it's a less number of surgery, looking at tumor surgery also, we are not getting more cases. So
good.
we allow fellow to intercity as well as in city, some 2-3 weeks time for to learn for particular their interest or to fulfill our criteria. So that must be, I think we should allow. Suppose in some fellows have some robotic part exposure as a part of curriculum. Let him to visit Apollo Hospital for 2 months, 2 weeks is more than sufficient.
Very true. Sir, I'll tell you that 10 on 10 fellows, which we had for the session 1 and session 2, talk about this point that the first question someone asks is what is a hands-on, what is a stipend? But at the end, what they realized was hands-on did not matter much. What mattered was decision making. What mattered was how to go about in a fellowship program. So your point well taken, sir, that hands-on is at the beginning, but when they come out of the training, they have a different perspective. But as you brought about this topic of multi-center rotation, I would like to ask Dr. Dhillon, that what do you feel, sir, about this multi-center rotation? Is it possible in our scenario, and is it possible in the spine training per se?
I feel it is definitely possible in our setup. If we have multiple ASSI centers offering the fellowship, you can have a rotation for a fixed period, maybe 1 month, 2 months, 3 months, whatever is decided through the various institutes for all the fellows, so that they can probably get exposed to all the possible mentors available for a short interval. It may not be 1 month, it may be 15 days also. Or if not all the centers, at least a few centers, so that you get a perspective from the other surgeon point of view also. When I was a fellow, there were very few centers offering fellowship. So, and there were the centers which are offering fellowship, they did not have any rotation policy. So this rotation policy definitely helps you, because one center cannot be expected to impart everything that is going on in the field of spine surgery all the time to all the surgeons. So this rotation policy definitely helps.
Dr. Shankar Acharya, sir, again, your views on rotation policy. Is it possible in our spine surgical training, and can we implement it in our SSI program?
The whole thing is that the 2-year session is only such a small session that will it add by sending the person to another center within those 2 years, or should he be left to do this on his own afterwards? Dr. Acharya.
Yeah, Abhay and others, and I was in my car, so my signal was not good. So I heard in between, but I think I heard Dr. Sargent said, I agree with you that 2-year fellowship is a very small time. It takes about 9 months for the fellow to get oriented to the hospital where he works and know the pattern of work and what is expected of him and how to see patients and organize his thoughts about whether this patient would need surgery, and if he needs surgery, how to optimize this patient and things like that, how to put his records, how to learn surgery, how to hold the how to start doing little surgeries. However, in multi-speciality hospital like ours, it is very easy for our fellows to cross over to another theater and learn some spine neurosurgery or learn vascular surgery. And I don't have an ASI fellow, but we have FNB fellows and Gangaram spine fellows, and I allow them whenever we don't have a case or whenever they are free to go over to the OT on the other side and scrub up in the neurosurgical theaters. And also the neurosurgeons are happy to take them on and teach them very proudly about what is how to approach the spine intradural tumor or what they are doing. So that is very easy in a multi-speciality hospital. I think that is not a big issue at all. So definitely it should be encouraged. Definitely it should be allowed. and we should fulfill whatever aspirations. But obviously, it's, as I wrote in a message before, that it's a relationship. And when a fellow comes to the institution, we never were trained to be mentors. So when a fellow comes to the institution, we always feel that we have got the best students and we have no opinions about them. So how the fellow spends his 2 years, how diligently he spends, as I think Samir was saying, that what he does in his 2 years and what outcome he produces, what the impression that the mentor has. So it is up to the fellow also. There is some responsibility of the fellow also to participate in this fellowship along with the mentor and show his interest. So experience is not to the duration, but to the intensity. And that's very important to keep in mind.
Yes, sir. One point which came out of all this discussion was the cognitive aptitude and attitude of a fellow is the most important factor in the fellowship. And we all agree to that part. Again, coming to the feedback part of it, I would like to ask Ajay Shetty, sir, that do we have a plan for a regular structured feedback bilaterally from the mentors also and from mentee also? And is there a need of such sessions, informal sessions, and would it help to get it freely from both the sides?
Actually, as I mentioned before, earlier itself, it was brought out by Basu and Dr. Chabra last time that we should have something like that, that we should actually this whole program like thing, have an interaction with them, allow them to speak and get a feedback as to what they can improve. And also we have been thinking about implementing the rotation program, which will be discussed in the education committee further as to, and also with the mentors as to when it would be ideal, how long we can, because you can't have a huge rotation program like 6 months each. They will stay with one center, but they will tend to visit 1 or 2 centers of their choice for a short duration of time. I think it's a good idea. Definitely a feedback is necessary, not only for the mentee and for the mentor, so that the whole idea is to bring about candidates who are good. And the onus is not only on us, the onus is on the fellows, and onus is on ASI to do the best out of it, to get the best out of the fellowship program.
Ajay, you said that a feedback done in a public forum where like you can hear not a single fellow has actually said anything so far.
No, I understand your point. They will be sending a feedback only to the education committee chairs, and which will be blinded, which will not be shared with the mentors that it is coming from a particular mentor. It is just that these are the feedbacks from the fellows who have completed the program, and we should look at collectively how are you going to make things better. Whether it's feasible to do it and whether it's necessary to do it has to be discussed and brought into the action.
Absolutely. Vishal, before you make your point, I wanted to get Dr. SKS and Dr. Guru, if you all are still on. Would you like to start this feedback process in your own backyard? Like, would you, after what you heard from Dr. Agnivesh, be happy to take your fellow in a room and sit with him and say, tell me, how is it going for you? And do you have anything to say one-on-one about your, the hierarchy that's been looking after you? Do you feel you're mature enough to do that? And do you think you'll implement it, ASAP, Dr. Srivastava?
Yeah. Actually, if you see, a mentor knows what is going in the mind of, the trainee. I'm telling you, if you are a teacher, you know very well. And in fact, if you see, Agnivesh has actually explained everything in his slides. The foundation of this, any course, teaching or learning course, should be from the foundation, which has been actually nicely explained by Raja. Okay. So they have to earn it. They cannot, expect it to be put in the plate. So this is the foundation. So they should understand very well, because this is extremely important in any teaching and learning situation. That is one. Second, Agnivesh himself had mentioned in the slide, all parents also had mentioned, they are biased about some of their kids. Why this? Because that kid has earned something, because of his behavior, because of his nature, because of his sincerity, because of his promptness. Okay. So actually this same thing happens in this fellowship program also. or for that matter, even in a medical college, you have 4 registrars. Now their registration number has increased. You have 4 registrars, you closely observe them, you silently observe them. You know what is what, some of the teachers used to tell us, we want an honest and hardworking registrar. We don't want an intelligent registrar. So that's how that person should fit into the system nicely. Okay. And a mature teacher knows what is going in the mind of that. But same time, keeping with the pace with the present situation, we should have this feedback. It is important. Okay. Because both sides should be balanced. Okay. It should be balanced. Okay. So I think everything has been covered very nicely.
Yes, thank you. Thank you. Dr. Kulkarni or Dr. Guru or anyone else?
Yeah,
Vishal, your Guru, yes.
Dr. Abhay, yeah. So the point which you had asked, actually, all the mentors, we know that sometimes we do have some difficult fellows where we feel that they are not really up to the mark and they are not really doing the job which they are supposed to do. So as a mentor, you always tend to talk to them, if not in a single room, maybe on the rounds or in the backyards. And then you call them, if at all they are receptive, you call them and try to talk to them and tell them. But then, as everybody else mentioned, we cannot just spoon feed this age group people. They are already graduated, they are postgraduates, they have families. So we expect certain basically responsibility. They should feel the responsibility, and then they should understand what mentor expects also. So rightly said by all mentors that it is not only the mentor should understand what mentees want, because I have been on both sides, and but then the mentee also should expect what mentor wants from them. So then only the fellowship can be successful.
Dr. Hargaonkar, you're in that young mentors category. Can you unmute yourself? And do you actually take a fellow into confidence and ask for a feedback and chat him up over a beer or a coffee?
Yeah, hi. Abhay, it's a very interesting discussion which we all are having here. But yes, we do ask our fellows in between, do you really need anything? You need something specific in this thing. We make an attempt at least every 3-4 months. But is it okay if I talk for a minute or two?
Yes, yes.
Yeah, I completely agree with the discussion, but I feel there are a lot of things which we need to understand. Number one, how busy the center is. If we are planning for the rotation in these 2 years, these are the very small amount. 2 years is nothing. 2 years, we are just trying to rotate. We are trying to do this neurosurgical training. We are trying to do this training, research also. How it is possible in these 2 years? We need to have a dedicated 2 year. Let him understand one concept. Let him have one basic understanding from one particular unit. At the same time, whenever he gets time, he can definitely go, rather than going to other city or somewhere for 1 month, 2 months, that he can definitely do afterwards. 2 years time, he should completely dedicate to the unit where he is posted. That will make a big difference. We should not, and yes, one-to-one discussions are important. We should have a planned system for them, like we have the some kind of workstations or some kind of their expectations, what they want, and not every fellow will get surgical hands-on. Various centers have different type of work. Maybe some MIS surgeon may not be happy to give immediately to the any guy who is coming, but maybe open surgery they will give. But it is up to the particular student. I always believe that just like you take the example of Satya Nadella or Sachin Tendulkar. Acharya taught Tendulkar, there were thousands of students. But why he excelled? Because he wanted to excel. And that is a very important thing. It's not an institution. Vishal was talking about when someone is from higher center or A city or B city. Satya Nadella is from Manipal. He is not from A city or B city, and you need not be from IIT. If you are good, you can be the head honk of Microsoft, one of the biggest company in the world. So I think we should understand, give freedom to the fellow. He should not be stressed that my boss is coming. You should be doing your routine work, what you're doing. Rather than spoon feeding them too much, it will destroy. let the unit, whichever unit, just let everyone follow their protocols. Everyone is mature enough. And you should have one-to-one understanding with that fellow about his problems. We don't need to have feedback sending here and there, and then they're asking, what do you think? Why it is required at such a mature level for a fellow and mentor, both.
Okay, I can see a future president of the ASSI and you, Shailu. Thank you for that feedback. Yes, Samir and then Harshal, you can take over.
I wanted to talk about this feedback concept. So see, our fellowships, there is also a market. There is also a market economy which is taking place. ASSI throws up X number of fellowships. I'm not sure whether it's 11 or 12, and all the fellows speak to each other. So they give an exam. They have a merit list, and they actually, the All India fellows speak to each other. They speak to the present and the past fellows. So they do know what they're getting into. Nobody can say that I wanted to learn. I wanted to. Okay, I do everything. So I wanted to learn MIS and I went to somebody who doesn't do MIS. So the thing is, the fellows know, or there's nobody who can come to my unit and say that, oh, I thought I'm going to get surgery from the first week. They jolly well know I'm not going to give it to them. So everybody speaks, and after that it's a market economy. So the one who comes first in the exam gets to select the one which is market economically the best for him, whether it is stipend, whether it's hands-on, whether it's research, whatever it is that they like. So there is a market economy. Regarding a feedback, giving a feedback to ASSI or something doesn't make any sense. I will tell you why. I mean, it may sound a bit dictatorial, but what is the point? And I hope that whatever it is, I know that the worst fellow of mine has given the worst feedback to ASSI once. And that fellow, he was so terrible and he gave a terrible feedback. And it was like, what the hell? He's the laziest guy who never did any work. He never did anywhere, and he's giving a feedback that, oh, I was done this, I was too. So that doesn't work. The feedback does not work if this thing. How feedback works in my unit is, yes, it works differently. Abhay, you are a very friendly guy. You take them for beer once a month and you are approachable. I am less approachable, which I know. So I have a hierarchy in my unit. So the senior most fellow, I have 3 in my unit. So the senior most fellow acts like a bridge. He's like a lecturer. And I keep asking him, juniors ko pooch, kuch problem hai kya? Do they have a problem? Is his accommodation okay? Does he need food? Does he need, is that okay? Is he meeting his wife? Is he studying? Is he? And that middle guy tells me, because by the time he spent 1.5 years with me, he has become more comfortable with me and he knows my moods. He knows when to talk to me when I'm not in a bad mood. So there is an internal feedback mechanism, which is unique to each different combination. You see, Abhay may be a different person to approach. Dr. Raja is too huge, but I'm sure Raja has got his thing. Like somebody will speak to somebody will speak to Ajay, and Ajay will put the important things in Raja's ear. So that's how it works. I think that's how a fellowship is, and each fellowship is different. You can't compare a fellowship in Indian Spinal Injury Center where there are X number of consultants to a fellowship with me where there's only me, right? So it's a different skill set which I am giving them, and a different thing which they are giving there. So I think that's also important. There is a feedback and there is a market economy there. We can't say that we are not providing that.
Yes, sir. Shailesh sir and Vishal sir raise hands. So I would, Shailesh sir, you can start.
Yeah, and again, this rotation within 2 years, I think it's not a really good idea, because they take some time, 4 to 6 months, to adapt a system, and then suddenly he's going somewhere for 15 days or 1 month. It's disturbing for the unit. It completely collapses everything. Yes, if health issue, we understand, but otherwise, I think these 2 years we should not consider rotation amongst, because there are a lot of things happening at one time. OPDs, theaters. Sometimes because of COVID, everyone is very light, but otherwise it's really busy. You really don't get time to breathe. And the fellow is your most confident, he's your right hand. You need him all the time. You can't just tell him, you go and come back after 1 month, we'll see how it goes. Who will replace him? It's again going to be a problem for the unit, because it's a practice where we have to treat patients also. We can't get disturbed and do the practice, because some other person cannot take his place. When you're training him for 4 to 6 months, he's continuing, and then again you're telling him go back and come back 2 months. Why for?
Vishal sir.
I think all these points so far, what I feel from fellows' point of view, by putting these words, what Agni did or what I did or what the fellows want, we don't want to get the fellowship fellow oriented. We are not asking everything. At the same time, it cannot be mentor oriented only. You cannot create a IAS officer or a IFS officer of a particular type because uska teacher ya uska trainee hai. No, you cannot do that. You have to create a uniform level of IAS officers across the country That's the holistic development of the country. Only then it's going to happen. And that is why a holistic program, which is uniform across the nation. Of course, there can be some micromanagement happening at the unit level, but for a broad nation like ours, you have to have a uniform, structured, disciplined program. That is number one. Number two, a periodic assessment and a feedback from mentor based on his observation and trainee perspective is extremely important. At the end of 6 months, if you don't ask the trainee कि तूने क्या सीखा या तेरे को क्या तेरे दिल में extra क्या सीखने की इच्छा है, how will you know what are his prospects? How will you modify the program? At the same time, if a mentor only don't tells the fellow कि you are not handling your dura well, you are not preparing your end plate well, or your screw insertion technique is too crude, you may want to soften down there. Unless until that kind of training happens with a periodic feedback mechanism, it may not necessarily has to go to ASSI or to some senior, because they probably will have no control on anyone, not surely like Dr. Dalvi. But there has to be a periodic assessment, because at the beginning of the fellowship, you are defined that in 6 months my fellow should be able to do T-lift, in 12 months he should be able to do a TPD, in 18 months he should be able to do percutaneous fixation, and in 2 years he should be at least able to put screws either in C1, C2 or in a spine deformity. So if you have defined the program earlier, at the 6 months, you yourself can assess whether my teaching has been able to achieve this or not. And if not, who is at fault, whether it is the fellow or the mentor. And whoever is at fault, how to improve. This assessment at 6 monthly interval is extremely important. And the third point, what Shailesh mentioned, I'm not contradicting this, but I think there is always a pre-joining period of a month, and there is always a post-examination or final assessment 1 month, which is after examination. Why can't we utilize this pre-joining 1 period to bring the knowledge levels up, and post-examination 1 month for the rotational completion? So this will be like a comprehensive thing, satisfying all the quests without disturbing the functionality of the unit, and yet giving what the fellows really would want to cherish forever.
Very aptly said, sir. So coming to that, your first point about curriculum, we know, we have seen a lot of literature that the world is moving from a preceptor-based training to more competency assessment and everything, which you have very elaborately mentioned in your PPT. I would like to ask Kulkarni sir and Dr. Basu that do we have a scope of putting an objective-based curriculum for these structured programs, because we have multiple programs, FNB, ASSI and all, but is that a possibility in our spine training?
There can be a little bit of an objectivity in the theoretical part of it, but I really do not believe that the clinical part of it can have an objective sort of timeline. For example, we do have 20 or 22 point spine modules which are covered usually by one or the other seminars or lectures or something like that. But I can never guarantee a fellow that within 1 month he'll be getting this number of deformities to see, he'll be getting this number of CVJs to see. So the clinical learning is a continuous process. It cannot have a syllabus, it cannot have a curriculum. But the theoretical part can definitely be covered up in some modules, and I think the way the ASSI has improved upon its educational performance in the webinars and all the lectures that are being organized for the fellows, there is a reasonably good coverage of the theoretical part of it. But again, the clinical part is too abstract to be defined like that. It cannot be. And again, as I said before, the training is a continuous process. It's more of an observation. It's more of grooming. It's more of sort of mixing up in the entire group so that you get yourself trained.
Dr. Kulkarni, you are muted, sir.
So I agree completely with Basu. See, the objectivity works out this way. As Samir described, it is a reward that the fellow keeps getting one after the other, and that is how he gets it. So if he is mature in handling preoperative work, ward work, his maturity in managing patients in the ward, his maturity in teaching his younger fellows, that the mentor will immediately realize all that. And now if he is mature in understanding what implants to order, what is the bailout implant that you're going to order, he has a sense of understanding of how mature this guy is. So the next reward will be, probably he'll get exposure next time. So, if he exposes well, and during exposure, if there is a lot of bleeding, he makes it a point to call his mentor and, not be adventurous. that is a sense of maturity, responsibility that he shows. So such kind of behavior, will give confidence in the mentor. Then he'll go to the next step of probably giving him decompression. So these are the objective, objective assessment of the fellow during the training and allowing him to do more and more things. Suppose he feels that this guy has a keen interest in research, and he leads the way. He knows some statistics. He knows how to do a review of literature. He knows what is lacking in literature. So that kind of maturity gives him, creates an impression in the mentor to give him something more to do. So these are the smaller rewards that help him, help the mentee, grow. And as he said, it's a continuous process. Where is the full stop? The only reason we have exams is at least let them go to their books. Otherwise, some of them may not be, they may be just wanting to finish off those 2 years and start practice. So that is the reason, that we have these exams.
So taking the track of discussion to a different level, now we are talking about soft skills, which Dr. Vishal mentioned earlier. And I would like to take Dr. Nene's perspective that developing soft skills, how much importance do you give and what you instill in your fellowship training to make sure that fellow gets that through you?
I think it's a no-brainer that a complete spine surgeon is the person who, aside of knowledge and hand skills, has the ability to communicate. And that is a point that's sorely lacking in our medical system as a whole. We've all learned it on the fly and learned it on some flagging patients. Announcing that bad news is not an easy job, and a doctor should come across in a very different way when you announce that bad news. You may have done the best surgery, but if you don't talk to your patient. So you guys know what I'm talking about. And hence, I think, of course, each of us should contribute to teaching that, and the fellows will see how you speak and how you learn. But we come from a very high pedestal as a practicing busy spine surgeon, and the skill sets that they need to put to use when they start their practice are quite different than what, a guy of a high pedestal can just tell his patient. So I think it's important that every fellow, gets the hang of soft skills. And at this point, I think just like the ASSI is making inroads into a research, research workshop, we should have a soft skills workshop, run by people who are, non-medicos. And I got taught soft skills by a person who was a non-medico. And similarly, I think I'll appeal to the ASSI hierarchy to have such a workshop uniformly across, first for us and then for our fellows.
So now coming back to something with regards to policy, we have something called as Certificate of Additional Qualification or Accreditation of a Fellowship Program. I would like to ask Dr. Ajoy, I think he's here, regarding the efforts, can we make that fellowship by ASSI as an accredited fellowship or a fellowship for able to take an additional qualification certificate?
Understand what you are asking. It's like whether it can be registered with the Medical Council of India. But unfortunately, a fellowship which is not approved by the Medical Council of India per se, which is not started by them, it's very difficult to get it approved. We have thought of it. We had earlier discussed with it. I'm sure Basu would be able to say something about it.
Thanks, Ajay. So, Harsha, this is a very important point that we've had a discussion in multiple executive committee meetings in the ASSI. The real point of the problem which Ajay has pointed out is that we as ASSI are a statutory body. This is an AOP, an association of persons aimed at educating and training professionals in spine surgery and related skill sets. And all degrees or all certifications or all diplomas has to come from a university level body, which in the clinical practice has to be registered with the MCI or now whatever the new body has come in. So therein lies the problem. Any association cannot actually give out quote unquote degrees or certifications. We can acknowledge your fellowship program by a certification, by a ceremony, but it can never be just like an FNB or just like an MS Orthopaedics or MCH neurosurgery, because they are sort of given an university stamp, which we cannot. The next step possibly in the future is that as all associations are having their own fellowship programs, to have some sort of an accreditation or a sort of semblance of a stamp from an university that yes, this is a fellowship program which meets the criteria. For example, in the future, I think there would be criteria of fellowships across the medical board coming up. For example, the National Board of Examinations or some other, just like UGC, you might have a central organizing body which comes up with the criteria of a fellowship program, and the SSI might apply that this our fellowship program should be certified by that. When if that comes up in the future, we can have a certification process. But till that point in time, we have to wait and watch.
Yes, sir. So accreditation is a possibility in a distant future, but not right away. And Dr. Nene, you would like to ask?
I think I think a lot of points have been discussed, and we've not had a lot of fellow representation. Though there was an important point Dr. Hriday made, that maybe we could put our what our fellowship has to offer out there, so people can choose wisely. But like Samir said, that information is already going going around in the fellows group. So I think for want of time, we should wind up. Isn't it? It's 9:30, and it's close to dinner time. Yes.
I have a question for you, Ajay and Samir.
Yes.
So when I wanted to do spine, there were only 3 fellows who were doing spine who were doing fellowship in spine. In the sense, Samir was getting trained under Vijay, you were under Dr. Bhojraj, and Ajay was with Raja. That was the year the first FNB fellowship started with Raja, and there were very few training centers. Would you have a meeting like this with your mentors then? तुम मुझे ये दो, मैं तुमको ये दूंगा.
Yeah, I mean, I think that point Dr. Basu made very clearly then, that when there was no choice, we just had to suck up and do, and we really sucked it up. We gobbled it up, as Dr. Basu said. And today, because there's a choice, and like Dr. Raja said, when you're in the 5-star hotel, you start looking at the dress that the waitress is wearing rather than the food on the table. So your point is very well taken, Arvind. We would not have had such a meeting then. But I think today, with the bar being raised, yeah.
Just give you an example. So today we did a Scoli, and I have fellows. So I asked them, why you undercounted the rod on the convex side. Okay, so none of them, right from junior to senior, knew it, though we have been doing Scoli for so many days. And when I was as an observer with Lahiri, I actually dug it up. There was very less literature then. I went to Wardia, Pediatric Wardia. There is a Weinstein pediatric spine book, and there it was given the coupling and uncoupling part. So I dug it, and there was no Google then. So things which are given on a platter, no one
necessarily appreciates. Yeah. But I'm eager to have a similar meeting with the fellows to get, because I think they're just being silenced. And yes, Dr. Raja.
Yeah, that's why I put a half jokingly, half truly. I was just asking Abhay, so Abhay, when are you going to hold a webinar on what is the responsibilities and duties of a fellow who is joining an ASSI fellowship? So, it is both ways. And when an association or when the leadership of an association also starts concentrating on only one thing because it is fashionable, or it is the trendy thing to discuss, or this is actually the one-way traffic that has to go, I think this is not the right thing to do. So, all the fellows and everybody in the training has to know that life is a package. I mean, wherever you go, in whichever situation, whether it is the fellowship you do, or your life partner, or you enter into a marriage, or it is in a family situation, there are plus in everything and there are minus in everything. You can't get married to somebody who's very beautiful like Aishwarya Rai, but who will cook like your best cook in the kitchen, and who will do your household work, who will be as good as your efficient secretary, all put into one. No, it's not like that. And similarly, when you go to a fellowship, whether it is to Ganga Hospital or to Sudhir or to Shankar or to Samir or to Abir, there is all goods, lots of goods and lots of bad. So as a fellow, you have to be really nice enough to think, in this situation, there is this institution, ASSI has given me this golden opportunity. I am so lucky to get into this institute. Let me absorb like a sponge, like whatever I can do here. And whatever I have not got it, let me do it in the next 1 year.
Meeting of this.
You know, it has to be like that. So I don't think it has to be on a platter. That's a big problem now. We are always discussing how can we make the plate bigger and bigger. Why can't the platter be little more? Why only one soup? Why not two soups? Why only two desserts? Why not three desserts? No, that is also one thing. That's okay, good. We talk about the food. But Abhay should also think about organizing on how the fellows can perform better.
So with that fantastic feedback from Dr. Raja, I think it's late in the day. Thank you all for making it. I will just make some concluding. I picked up some stuff that you all said, beginning with what Dr. Agnivesh very poignantly pointed out, that, fellows' outlook to the problem, and clearly the one-on-one chats with the fellows about their well-being, blinded feedback with independent assessment, multi-surgeon training, neurosurgical training. Dr. Raj from the fellows group said foreign fellowships. I think these are, things that the fellow looks at as a reaction. Of course, Dr. Raja, I think, stole the show today by talking about entitlement, and that became the kind of, thread of the discussion after that. And it is clear that, the onus really lies with the fellows, because different fellows come from different backgrounds, and, each one will, do as well as they want to. Dr. Sajan also agreed that this is a basic training program, and the onus is upon us to give them basic training in 2 years, and hence giving them subspecialty training in these 2 years is really not, not a mandate. Dr. Basu felt that, there's a problem of plenty now, and the fellows are being more demanding because there's so much on the platter out there for them. But the fact is that there is so much on the platter, and now it's a buyer's market rather than a seller's market in a way. So maybe we got to take a long, hard look at what is current, and not delve on, how it was in our time. So we have to move with the times, lest the next guy offers something better. When I meant the next guy, I meant that we need to match up with the best fellowships in the world. Dr. Samir said that it is an active learning, and the trainee will again absorb as much as his capabilities are, and there's no role for spoon feeding. And then we had Dr. Vishal come in again and give again some great pointers about what fellows need. And remember that Vishal and Agnivesh were, the dice was loaded for them to talk on behalf of the fellows, to create some ripples in our thinking. And so predefined fellowship objectives, tell the fellow what you intend to teach in your 2 years, fellow assessment sheets, reports at intervals, the possibility of a uniform curriculum throughout the country, so everyone trains on the same from the same book, and of course the importance of non-academic teaching. Dr. Hriday put his thoughts about expectations versus the mismatch of expectations between fellows and the mentors and the mentees. And we did talk a lot about feedback and about structured feedback. And I think what we can take home at least is that at least a mentor can do a one-on-one feedback with the mentee on a regular basis. So we will improve the quality of learning and break the invisible wall between the two. Regarding multi-center rotation, there's been a diverse opinion in our group, and some feel that it's important, and others feel that 2 years is a very short time to offer multi-center rotation, because it will work badly for the trainees as well as the trainers, losing their fellow off for 3 months, and the amount of time available anyway is very, very less. So maybe it can be pushed to a later plan. Dr. Vishal said a uniform program, regular assessment of the trainee, a periodic feedback mechanism is a must. Dr. Basu and Dr. Kulkarni both agreed that it is difficult to create an objective curriculum because spine surgery is an art, and each mentor and each mentee comes with a different skill set. So it's impossible to create this kind of a curriculum as we had in the 10th standard, where all of us read from the same book and gave the same exam. Dr. Ajay added that maintaining a surgical diary and an observation diary is one of the ways that a fellow can maximize his learnings. We talked about soft skills, and I think all of us should contribute towards soft skill training, at least from the medical standpoint, with all our fellows, because it's then up to them to display them in their early practice. we cannot give a degree, and that's the unfortunate truth. We are an association, but hopefully in the future something better may happen. And then finally, Dr. Raja, summed it up again, that fellows should really maximize what they get, and do ask not what the mentor can do for you, but ask what you can do for the training program. With those final thoughts, does anyone have?
Yeah, I do.
Yes.
I do.
Yes.
I think it has been very insightful, and it was good to know from other mentors as well what were their thoughts, and Vishal and all these people. So there is nothing new which they have said. We all know that they all want this, and we try. What I think the sum of the matter is that the mentors need to improve a little, but the mentees or the fellows need to improve a lot. So if the fellows improve a lot, then they will get a lot more, because I'm seeing the fellow standard is actually going down and the mentor standards are actually going up. That is what I'm seeing. When somebody said about rod contouring, they don't know that, that is still different. I know people who can't even describe, who can't describe the lateral mass entry point, a clinical sign, or if I tell them to expose the anterior cervical spine, they don't know the layers when they're post MS and 1 year post fellowship. So if these guys have not read and don't know their things, means they're just going downhill. The other day I offered a prize to my fellows. Nobody knew what Munchausen syndrome was. And I went around asking everybody in the hospital, and I was shocked that people don't know what Munchausen syndrome is. And as a spine surgeon, that's the first thing you need to know. So I think fellows need to improve. They have to have a better attitude to reading, to knowledge, to absorbing knowledge, a better attitude to hard work, and a better attitude to working and not expecting. And if you work and you don't expect, then you will get. Simple.
Yes, Ajay, you wanted to say something?
Before we conclude, my special thanks to Abhay and Harshal for making this a reality. I think, there are positive points, there are negative points, but at least the points are in open. And it's important for us to consider, like Abhay put it in the end, like times are changing, we have to take certain things, and we have to look into what has been discussed and how we can improve and what we have to do to get the best out of the fellow. Thank you for both of you for making this a reality.
Harshal, if you can conclude.
Yes, sir.
Yes, Dr. Basu.
Yeah, I just wanted to end this by saying that the mentors are really improving. I don't think Samir, the mentees are going down. The fellows are really good. It's a fantastic experience for me as a mentee to have some time with the fellows, and considering this webinar as spending time with all the fellows down there. There are about 20 in the various boxes in my screen. I'm proud and thankful to Abhay to have actually created a platform where we could spend some time with the fellows. Grateful to you, Abhay.
Thank you. Harshal, can you conclude?
Yes, sir. So we had a nice 3-session webinar on fellowship training and education. For first 2 sessions, we had more than 5,500 views on all the different platforms, and it was a successful program, which I would say. And I would like to thank all the speakers who came forth and spoke about their experiences. Today, Dr. Agnivesh and Dr. Vishal, they really tried to put forth the fellows' perspective in front of everyone. And to the panel who really gave their full attention, time, and their valuable suggestions for the improvement of our fellowship training program. I understand the one conclusion of this is what the fellows' aptitude and attitude is the one which matters at the end. But yeah, our fellowship training has been a life-changing experience for many of the fellows. And I would like to thank everyone who contributed to this discussion.
Thank you all the mentors for taking time, Dr. Raja, Dr. Dalvi, Dr. Basu, Dr. Tharata, Dr. Ajay, Dr. Kulkarni, Dr. Srivastav, the whole lot of you, Dr. Hadgaonkar, Dr. Dhilan, everyone, took out time on a weekday after evening. That tells us how important it is for all of you all to be a part of this. Harshal, yes?
Yes, and I would finally like to thank ASSI, Dr. Nene and Dr. Ajay Shetty for guiding me through this process and to make this happen. Thank you, sir. And thank you, Dr. Shankaracharya, sir, also.
Thank you so much. Good night.
Bye.